Welcome to Bert's TV channel. In this video we will talk about 8 foot care tips for diabetics. People with diabetes commonly have foot problems. They're scared they might lose a toe, foot, or leg to diabetes. But the chances of having diabetes-related foot problems can be avoided by managing their blood glucose levels to help keep their feet healthy. In the long run, diabetes may cause nerve damage that can cause tingling and pain, and can make them lose feeling in their feet. When feeling in the feet is lost, diabetics may not feel a pebble inside their sock or a blister on their foot, which can lead to cuts and sores that can become infected. Diabetes also can lower the amount of blood flow in the feet. Not having enough blood flowing to the legs and feet can make it hard for a sore or an infection to heal. Here are 8 foot care tips for diabetics. Number 1. Check your feet every day. You may have foot problems but feel no pain in your feet. Checking your feet each day will help you spot problems early before they get worse. A good way to remember is to check your feet each evening when you take off your shoes. Check between your toes. Look for problems such as cuts, sores, or red spots. Be watchful of swelling or fluid-filled blisters, ingrown toenails, corns or calluses, and plantar warts. Number 2. Wash your feet every day. Wash your feet with soap and warm water. Do not soak your feet because your skin will get too dry. After washing and drying your feet, put talcum powder or cornstarch between your toes. Skin between the toes tends to stay moist. Powder will keep the skin dry to help prevent an infection. Number 3. Smooth corns and calluses gently. Thick patches of skin called corns or calluses can grow on the feet. If you have them, talk with your foot doctor about the best way to care for these foot problems. If you have nerve damage, these patches can become ulcers. Do not cut corns and calluses, use corn plasters, or use liquid corn and callus removers. Cutting and over-the-counter corn removal products can damage your skin and cause an infection. Number 4. Trim your toenails straight across. Trim your toenails when needed after you wash and dry your feet. Using toenail clippers, trim your toenails straight across. Do not cut into the corners of your toenail. Gently smooth each nail with an emery board or non-sharp nail file. Trimming this way helps prevent cutting your skin and keeps the nails from growing into your skin. If you want to get a pedicure at a salon, you should bring your own nail tools to prevent getting an infection. Number 5. Wear shoes and socks at all times. Wear shoes and socks at all times. Do not walk barefoot or in just socks, even when you are indoors. You could step on something and hurt your feet. You may not feel any pain and may not know that you hurt yourself. Check the inside of your shoes before putting them on to make sure the lining is smooth and free of pebbles or other objects. Wear shoes that fit well and protect your feet. When breaking in new shoes, only wear them for a few hours at first and then check your feet for areas of soreness. Number 6. Protect your feet from hot and cold. If you have nerve damage from diabetes, you may burn your feet and not know you did. Take the following steps to protect your feet from heat. Wear shoes at the beach and on hot pavement. Put sunscreen on the tops of your feet to prevent sunburn. Keep your feet away from heaters and open fires. Do not put a hot water bottle or heating pad on your feet. Wear socks in bed if your feet get cold. In the winter, wear lined, waterproof boots to keep your feet warm and dry. Number 7. Keep the blood flowing to your feet. Try the following tips to improve blood flow to your feet. Put your feet up when you are sitting. Wiggle your toes for a few minutes throughout the day. Move your ankles up and down and in and out to help blood flow in your feet and legs. Do not wear tight socks or elastic stockings. Do not try to hold up loose socks with rubber bands. Be more physically active. Choose activities that are easy on your feet, such as walking, dancing, yoga or stretching, swimming, or bike riding. Stop smoking. Smoking can lower the amount of blood flow to your feet. Number 8. Get a foot check at every healthcare visit. Ask your healthcare team to check your feet at each visit. Take off your shoes and socks when you're in the exam room so they will remember to check your feet. At least once a year, get a thorough foot exam, including a check of the feeling and pulses in your feet. When should you see your healthcare provider about foot problems? Call your healthcare provider right away if you have a cut, blister, or bruise on your foot that does not start to heal after a few days. Skin on your foot that becomes red, warm, or painful, signs of a possible infection. A callus with dried blood inside of it. which often can be the first sign of a wound under the callus. A foot infection that becomes black and smelly, signs you might have gangrene. Ask your provider to refer you to a foot doctor or podiatrist if needed.